Welcome to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. We're starting the new year with another pregnant dog. This is a 3-year-old Corgi who's been in labor for 8 hours, has produced 3 healthy puppies. She's presently not straining, but has not passed a puppy for over 2 hours. Prior to this, in preparation for the big day, the breeder had a puppy count performed using ultrasound, and the total fetal count was 6. Therefore, when they came to you for this radiograph, they were expecting, since 3 puppies have already been born, that there would be 3 left. Let's start by counting skulls and spines on the lateral view. And I'm going to pop us over to the VD view, which I'm going to make smaller so that you can see. I am counting 1, 2, 3, 4, 5 skulls and spines are left. So, the message of the day: ultrasound is a great tool for monitoring pregnancy and for theriogenology in general. It's not always the best or the most accurate for counting puppies. Radiographs are always best if you want to plan how many puppies to tell a breeder to expect preterm. All right, let's look a little closer. In this case, we know that labor delivery has been delayed and that there's many puppies left to be born. So this is a different scenario than last week, where we were simply wondering how many more are we waiting for. We want to look in a case like this at the positioning, as well as for any signs of radiographic signs of fetal issues. That could include, for example, gas within the fetal vessels, gas within the fetal body cavities, so thorax or abdomen, separation of the skull bones. Sometimes what we can see, I'll go to the VD view for a sec. You can really get the sense on the VD view that most of these puppies have sort of a nice elongated posture. So if we take this puppy, I'm going to zoom in on this one for us here for a sec. You can see this nice posture. We've got a head, we've got a spine. Look at, we've got these front limbs kind of facing forward the way they should. So a sign of puppy distress that I don't see here would be sort of malpositioning of the puppies, which can be, if they lose vitality, then they can sort of lose that passive muscle tone and that moving around that they would do if they're healthy. So radiographically, if you look, most of these puppies have a uniform soft tissue opacity, so I'm not seeing any gas superimposed or any concerns radiographically for fetal distress. Of course, you definitely want to reach to ultrasound as a tool for a better assessment of fetal distress, where you could monitor the fetal heart rate. But let's go back to our RADs to look at positioning. We talked last week a little bit about the fact that puppies can be born breech or pelvis first, but they shouldn't be, it could become difficult for them to be born if the hind limbs are extended cranially towards the rib cage. So here's my upside down puppy who's first in line here at the pelvic inlet. We've got the spine here, we've got the skull here, sorry, and then the spine. Here's the rib cage. This box-shaped structure here is the pelvis, and then you've got the femur or the hind limb kind of extending cranially towards the rib cage. So this is a concerning posture at the pelvic inlet. When I go to the orthogonal view, as you know that I always like to look on both views, there's a lot of superimposition, right, with the maternal pelvis, but you can see that not only is it kind of tail first, but it's actually a little bit transverse in front of the pelvic canal instead of kind of aiming caudally the way we would want it to. So in this case, we can conclude that there are several puppies left to be born, certainly more than 3. The one that's closest to the pelvic canal is presenting with its pelvis first and may have at least one hind limb cranially, which can result in difficult delivery. So consideration could be given to next steps based on clinical exam of the mother, ultrasound of the puppies if available, and could include non-invasive support or a C-section to ensure safe puppy delivery. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.